Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas, VACHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. As always, we certainly appreciate you joining us and listening to our show. And as you know, the purpose of our show is really bringing the common voice coming out of the Commonwealth of Virginia into your living rooms, into wherever you are, so that you can hear what's going on out here in Virginia, and as we look to provide healthcare services to many individuals within the Commonwealth. I'm very excited today because we have two fantastic women here who are in the midst, really, of a lot of the work that's going on here by community health centers, as well as free clinics here in the Commonwealth of Virginia. We're going to talk a lot about equity and inequity, if you will, as it pertains to accessing healthcare services, as well as being able to provide the best care we can to different populations in different counties within Virginia. That being said, sitting next to me is a individual who I just absolutely admire. She is the Chief Executive Officer of a community health center here in Virginia called Central Virginia Health Services. She has been at that organization for a good number of years, but has been sitting in the CEO position since 2018. She has been doing some fantastic things with her team and all the providers in the communities that they serve. In addition, we have a Dr. Catherine Tossas, and she is the director of the Catchment Area Data Alignment, Office of Health Equity and Disparities Research at VCU, Virginia Commonwealth University, Massey Cancer Center. So ladies, thank you so much for being here today, and thank you for wanting to have this conversation with me as we speak to the inequities that exist in some of our counties here. And I think one specific county we want to talk about is Brunswick County. Central Virginia Health Services provides services, healthcare services, primary care services, as well as a host of other healthcare services to this particular county. And part of the reason why we are highlighting this county, which is not uncommon with many counties here, not just in Virginia, but also in other parts of the United States, where you will find a lot of community health centers located, is in Brunswick County. We are looking at a population as of 2022, around 15,000, 16,000 individuals. 42% of them are white, and about 54%, 55% are African American. We have a median household income of about $46,000, and the poverty level here, as it rates to the other counties here in the state, is about 20%. And persons without health insurance runs under the age of 65, about 12.5%. That being said, Brunswick County is one of the least healthy counties here in Virginia. And audience, let me just repeat that, okay? Brunswick County is one of the least healthy counties in Virginia, and Brunswick is no different than a lot of other counties here in the United States. In fact, Brunswick is ranked 128 out of 133 for health factors in the County Health Rankings report. And with that being said, I'm going to turn to Paula here first, and I'm going to talk to her before we speak to what Central Virginia is doing in Brunswick to help address those staggering numbers. I do want to just kind of highlight a little bit, Paula, because for those people out there, right, who I profess community health centers all the time, and I'm always talking to young folks about the idea of getting into administration and working at federally qualified health centers. You've been doing this for a long time. Now you're a CEO of a federally qualified health center. Why? Why are you still in this industry?
This is the best place to be for healthcare as far as I'm concerned. My background in education was in healthcare management and also human resources. And I got started here at Central Virginia Health Services about 20 years ago, coming in through the human resources door. And I had the opportunity to interview with the CEO, who was my predecessor. And he just was so motivating about the work we do. And he lived the idea that it was a privilege to serve the folks we served. And so I came aboard this organization and came fully to believe that as well, that we are the biggest kept secret in healthcare. And it's really important for us as community health centers and the way we work to help to balance out the inequities in the healthcare system. We do a lot of extra work. We treat most of our patients as much as we can as individuals and really help address the individual needs that they have to get access to healthcare and to get what they need. Because no two people are treated by any disease the exact same way. No two people have the same issue in accessing care. And so we've got to use the overlying umbrella of guidelines of disease management, but really work with the individuals because so many of our folks have been left behind. There's a reason that FQHCs are called safety net providers, and it's because these folks have fallen through the regular cracks that some of us with insurance take for granted, or some of us that have had the opportunity to have better health education or access to information to understand what makes healthy choices. And these folks have been left behind or fallen through, and so it's up to us to weave the fabric that keeps them healthy and helps make a difference.
And Dr. Tossas, can you talk a little bit about why you do what you do? First of all, I want you to speak to what it is that you focus on a lot in your research and what you're doing over at VCU, Massey Cancer Center, and why? Why have that focus?
Absolutely. First of all, thank you so much for allowing me to be a part of this. And thank you so much for Paula for her advocacy and her work. It's truly a pleasure to be a partner, with her on this. I'm a cancer epidemiologist by training. But I say that, I am 1 degree of separation from a lot of this ailments that impact our community, right? So, my mother was diagnosed with 3 different cancers starting at the age of 33. She had diabetes, high blood pressure, high cholesterol, you name it. So all of those things were always very close. I am originally from Puerto Rico, born and raised. I'm a first generation college graduate, first generation here in the US. So all of these things were very, very close to my heart always. I sought care at an FQHC. My parents still seek care. My mother passed away, but my father still seeks care at an FQHC now at the Strawberry Clinic in Houston, Texas. So I know, and I am the product of the great care and the important care that federally qualified health centers provide. So my work is grounded in health equity. Everything I do, my research is on health disparities. And I have a basic science background. I say I'm a recovering basic scientist turned epidemiologist, population scientist. So my work is actually looking at the influence of the microbiome on cancer risk, funny enough. But the work that I partner to do with Paula and other federally qualified health centers, they're all around how we can bring the community and FQHCs together to jointly improve the quality and access to care in our communities.
And I'm glad you mentioned about Puerto Rico, that you're from Puerto Rico, because I was going to say that we actually have some federally qualified health centers in Puerto Rico, and they're doing some pretty fantastic things there. And a lot of what they're experiencing, right, Dr. Tossas, is a lot of what we're experiencing here in the mainland. So that's good to know. And maybe one day we'll have you back and you can talk a little bit about the inequities going on over in Puerto Rico. But that being said, the partnership between Central Virginia, Paula, as well as Dr. Tossas, can you talk a little bit about what that partnership is? What is it that the two of you, with your expertise over at Central Virginia and with Dr. Tossas' background, what is it that you guys are doing together in the Brunswick County?
Sure. So we were invited to participate in this group called Project Coalesce. VCU had written this grant and was doing this proposal and wanted to connect community health centers with a community partner, and seeing if those two groups working together could provide more education support and improve outcomes in their communities. And so it's kind of funny, I think. I was really trying to get her to work with a different group. When they first invited us to it, they didn't say specifically who they wanted to work with. And I kept saying, well, I have this group over here. They're really good with projects. Can we get them? And she's like, no, we really want Brunswick. And I was like, but Brunswick is small and whatever. And, and saying, don't you want more? And I didn't know the group they wanted us to work with. And so then they came out and they said, no, the outcomes are so bad. We need you to do that. And I was like, oh, okay, all right, let's get together and work on this. And so it's been really exciting. VCU has gotten the group together. We did not know each other very well. There was a little bit of overlap, but they have provided opportunity for us to meet as all of us, all the FQHC and community partners, to meet and talk about our different things and projects we're doing, as well as working individually with each of the partnerships to provide, guidance and training and what can we do, and getting everybody on board to do their PDSAs and things like that. So it's really, we've had some really interesting outcomes from the relationship, in addition to, helping to work on the health issues. It's been a much broader and much larger collaboration. So, but she can speak about what made them do the grant that got us all invited.
Absolutely. So I moved to Virginia. Full disclosure, I moved here a little over 2 years ago during the pandemic. I was recruited here by the new Massey Cancer Center director, Dr. Robert Wynn, who is an incredibly dynamic leader with a vision larger than life, that is also grounded in health equity. I've had the privilege to work with Dr. Wynn for over 7 years, and we definitely align in spirit, heart, and mind around our radical commitment to health equity. And it's really powerful when you have an opportunity. Leaders matter. And so it's really powerful to have an opportunity to have that kind of leadership. Dr. Robert Wynn at some point was the only African-American cancer center director of designated National Cancer Institute designated cancer center. And he has now, helped open doors for, I think, a couple of other African-American directors to be directors of NCI designated cancer centers, as Massey is. And so, under that umbrella, the goal of designated centers is, of course, to produce generalizable knowledge, but also importantly, to serve the catchment. So when I got here, I was charged by Dr. Wynn, okay, so let's learn and let's figure out how to serve. So this opportunity came about. It was, a project that was funded by Pfizer, and what they wanted were applications that would look at systemic race-related barriers to cancer care, to cancer outcomes through the continuum. So Dr. Wynn actually is a former head of an FQHC himself. So when we were in Illinois, he both was a director of a cancer center, but also a head of an FQHC. He is a Head Start kid. He also was a patient of FQHCs himself. So FQHCs are very natural for us to work with. So naturally, I literally went to HRSA. I downloaded the data. I started learning about the FQHC, started learning about, what is called our catchment area, where the people that we serve come from. And from that, we developed this application, and COALESCE stands for Clinics and Communities Tackling Racial Disparities, Systemic in Cancer Screening. So, we thought it was fitting that we would bring in Brunswick, of course, because as you started the show, you mentioned some of the outcomes for Brunswick. And also, speaking of Dr. Nguyen and in the spirit of Dr. Nguyen, to focus on what we're packing, not on what we're lacking. I will say that though Brunswick at the moment ranks 128th, I believe, of the 133 counties here in Virginia, that actually is an improvement from a couple of years back, where they were like, I think, 132. And so I know that that also has to do with the work that Paula and her group have done. So, the challenge was for FQHCs to either identify, or we can help identify, a community organization to do quality improvement to basically address systemic barriers. And in our case, we picked cervical and colon cancer. Why cervical and colon? Because if you know anything about cancer, cancer is hundreds of diseases. Only 5 will have a screening available. Of those 5 that have a screening available, there are 2 that have screenings that are considered preventable. And that's colon, because a colonoscopy removes the polyps, and cervical, because the PAPS also removes the dysplasia. So they are also cancers that their screening is reportable, right, for their metrics, for FQHC metrics. So we want it not to add burden, but rather to expand partnership. And, FQHCs do a lot of work. And so community partnership is important. One of the things that happens is that FQHCs are burdened by basically working oftentimes in isolation from the community, right? Doing their own marketing, trying to figure out how to get into the community. And so I know I had heard from Brunswick County where they were saying, well, there's hardly any doctors here. I think we only have 2 doctors in the whole county, and, there's no access. And I recall one of my very first conversations with Paula where she was saying, that's kind of frustrating because we're here and we're available to serve, right? And so I've heard this before, from our own FQHCs. I worked in the community of Englewood, which is in the south side of Chicago, that at some point had the unfortunate distinction of being considered the murder capital of the U.S., a distinction that I guess we shared at some point with Richmond, unfortunately. And we had one of our FQHC clinics there. And I recall doing this project, exploring infant mortality in our community. In the U.S., infant mortality, the rate is about 5 infant death per 100,000 live births. And in the community of Englewood, that figure at some point was 24 death per 1,000 live births. And we were there encouraging women to get screened, get their cervical cancer screening, their mammograms. And they were like, that's cute, but my babies are dying. That's cute, but I have to worry about bringing my child from school because they have to walk 2 gang territories on their way home. And so at some point, Dr. Nguyen, again, who's a visionary, was like, okay, then let's write a grant and let's learn about why their babies are dying so that we can provide that information, so that we can earn trust, so that when we invite them to seek cancer care, they are more open to it. And so we did that. Interestingly enough, one of the things that we learned through that process, we were asking them, so did you know about the clinic here? We learned that only about 3% of eligible women, young women, eligible to seek care with us, were actually seeking care with us. And so the question was, well, where are you going? And they're like, we just go to the ER, we go there, we go here. And they said, we didn't even know you guys were an FQHC. We didn't even know that you were there. We thought you were an STI clinic because many years before, that was an FTI clinic that was owned by the city. And so it made me think about some of the struggles that I think, Paula was saying. She was like, we're here, we're available, but somehow the community does not seem to know. They don't seem to get it. So we brought this partnership together. They are actually working with the Brunswick Health Ambassadors, which are this wonderful organization, that you guys have of, Brunswick citizens that are incredibly committed to improving the health of Brunswick County. And they are radical about it. And I think, one of the things that I love, again, about Brunswick, once again, focusing on what we're packing, not on what we're lacking, is that Brunswick County may have some issues with health. But I'm going to tell you that Brunswick County also has some of the most resilient, committed citizens to improving the health or circumstances in their community. And that commitment shows through Paula and through the work that they do at the FQHC, as well as through the work of the Brunswick Health Ambassadors.
And Dr. Tossas, I'm glad you said that, because that's part of the reason why we started this podcast, right? Because we really feel that that Virginians are fantastic. They are the voice, right? And they're the ones who can really tell us what the needs are for the community when it comes to health and when it comes to addressing outcomes and what it is that we need to do to help them get over the hump, right? And so I think this initiative in Brunswick is a good way to demonstrate, right, with the resilience of the individuals that live in Brunswick County, and then this particular program. And you mentioned the idea of using these health ambassadors, because at the end of the day, okay, if you think about it, where FQHCs, federally qualified health centers, are located, they employ a majority of individuals there that are from that community, right? So the way you can engage individuals once they come into the four walls of our federally qualified health centers is to have those individuals be able to have that contact. And these health ambassadors, right, because they're from the community, they know how to speak to the individuals in their community because they know what their folks are going through it, because they're going through the same thing, right? They can help bring them into the health centers. That being said, what kind of things were you looking for, Paula, when you were bringing in, because these folks are volunteers, right? They're volunteers. So what is it? What did it take to get these folks interested in wanting to do this?
So, well, I think it was very interesting. They made, I would say Dr. Tossas and her group made a good pitch to the Brunswick Health Ambassadors. There was definitely some financial incentive for us to get started and to participate in this. And so I know that was very helpful to both nonprofits. And so I think it was really interesting. Exactly, if I can speak to, it took the first year we spent getting to know each other. But one of our first tasks, we laugh, was to do a SWOT analysis, the strengths, weaknesses, opportunities, threats. We were supposed to do them of our own organizations. Well, we did ours and we came back. Well, the ambassadors thought they were supposed to do the SWOT of us too. So our first meeting, we came in and they shared our weaknesses, our threats, our opportunities.
Wow.
We were like, oh, okay. So it was a humbling experience. Absolutely. Because you were like, this is great information. This wasn't the task, but okay, we got to take this on. And so it's been very interesting because actually coming into it, we have a much higher rate of screening for colorectal and cervical cancers than a lot of FQHCs at this site. They were doing a very good job. We had to increase the numbers. So it was very important for us to get this information because we're like, we need to get more people screened. We need to bring more people in the door. And so interestingly enough, we are located in what was supposed to be an industrial development project for the county. And we were the first ones to go in. We were very fortunate. We had a good relationship, got a great deal on the land, but it never materialized. So we are down a hill at the below. You can't see us from the road. Not opportune, but a really beautiful building that most people didn't know where it was. So it was really helpful with this partnership with us, for us to hear from the community, to say, we don't even know where you are. Half the VHA folks were like, we don't know where they are. So our first step was to invite them into the office. And they all, to a T, were like, oh my gosh, this is really nice. We had no idea. But part of that was we were in the process of rebranding. And so we moved Brunswick up the list to get their new sign. So they got a new sign. And then part of this partnership that's so phenomenal is Dr. Tossas was like, why don't you have a street sign? And we said, well, we can't. We're on a highway. There's VDOT restrictions. We can't put anything up on the road direct. And the road has a raised median. And so coming south on one, you can't see it at all. And there's no sign. People drive by it. And the site reported how many calls they get a week saying, I can't find you. Where are you? And so Dr. Tossas got a grad student in a different department to help us do some geo mapping and all sorts of fun things and research to go to VDOT. And she actually got us a meeting with VDOT and they put signs up.
Yes.
And so it's great because we were like, there's no place. And we debated, well, we can't have a hospital sign, but what can we do? And they actually made a community health center sign to put on the side of the highway so that people would have indicators to now turn into our building.
Wow.
And so it's been that sort of relationship that's changed, that information, that collaboration working together for us to be able to do that. And then it's created speaking opportunities for us with the different things the behavioral health ambassadors are attached to talk about what we do, and people understanding it's not a free clinic. It's not a clinic just for people who are uninsured or can't afford anything else. We take all insurances. We offer medical, dental, pharmacy, all these other services combined. And so it's been a great way for us to advertise in a way that we struggle with in this day and age. I mean, you used to be able to take an ad out in the newspaper,
right? And
now you can't. Not everyone gets the newspaper. Not everyone gets what's happening. So it's a great way for us to get out into the community with people to understand what it is that we do.
Right.
And we would have never made that connection without Dr. Tossas' group coming in and offering us participation with this.
And, Dr. Tossas, I just want to kind of bring this down just a little bit in a way where I'd like to break down just a bit around some of these equity issues. One of the things you talk about is structural determinants of health, right? What does that mean? What does structural? Because I know as FQHC, right, in a free clinic, we are strategically placed, right, to really address these kind of things. And then when you hear Paula speak about some of the struggles that they went through, just in Brunswick County, to let the community know about them, right? But, can you speak to our audience and talk a little bit about what structural determinants of health are?
Sure. So, a structural determinant of health is to have a beautiful FQHC campus on a really nice, bifurcating road. And, unfortunately, it just so happens that there's this VDOT regulation that does not allow you to put a sign on the road. And now you have a beautiful clinic that nobody can find. That's an example, a perfect example of a structural determinant, of health, right? And it wasn't in that case ill-intended. They have a reason and a rationale why that policy is there, right? But there was not necessarily the thought that, I guess we have to have some flexibility because if there's a community clinic, people should be able to find it. Another example of a structural barrier is that, we have a new EHR. We spent all this money, and that EHR includes sending text messages for you to confirm your appointments. Except that, Mr. Jones has a beautiful iPhone that he can purchase, of course, except that he only gets reception under the framework of his bathroom because broadband does not work properly in your area, right? So that's another example of that. We have the exact same phone, but your phone works there and mine does not. So those are just a couple of examples of and why those, of course, impact health. So I think Paula mentioned something that I wanted to expand a little bit on the fact that there was a financial incentive. One of the things that we did that was powerful about this grant, and it's powerful around when you do health equity work, is to acknowledge that everybody has equal power, right, and equal voice. And part of that acknowledgement is to equate the finances as well. So in this grant is unique because we decided as an institution, Massey, that if we were to get this grant, that we were all going to divide the money in the exact same amount. The university, the FQHC, and the community organization. You can imagine that was not too popular at the beginning because it's somewhat unusual, right? But the work that we have been able to do through that process, that has allowed us to do, the kind of grace and trustworthiness that has built between the community organizations, the FQHCs, and the institution has been much more valuable than any millions and millions of dollars or grants that we could have gotten by ourselves. So those things are important. This sign that Paula mentioned, I will say that, yes, it was, again, I'm new here. So we just put a Google map and all of a sudden, 90 minutes later, it said arrived, and we were in the middle of nowhere. That's kind of how it happened. And when I asked Paula, she was like, "Oh, we're not allowed." And I came back and got curious. But this would not have been able to have been done had we not had the partnership of Senator McClellan, who oversees the Transportation Committee, and who I was able to then approach, and she was open to that. And so that brings me back to another point that you said earlier about Virginians. Again, as a new Virginia person, one of the many beautiful things that I have learned about Virginians is just that Virginians, you're like, yeah, there are these issues here. Let's figure out how to work together, and let's roll up our sleeves and let's do this. And I will tell you that has been incredibly refreshing to see that from, leaders like Paula all the way to the neighbor down the street who is brand new, who can come to me and say, "Dr. Tossas, you use like about 5 of the 7 words that you just used. I don't understand. I'm going to need you to talk different to me because I want to understand you and I want to be able to partner with you." To be able to teach me that bilingualism has also been very valuable. And it gives me great hope, and it has facilitated it brought a lot of opportunity for us to do great work together, because both the leaders and the individuals that live in these communities in Virginia have been incredibly open, and they are ready to change.
This came at, if I can tag onto this too, it came at a really good time. And so we, for example, used our incentives to do more advertising. When we first got started with this, we were still in the heat of trying to get everybody vaccinated. And Alberta, the Brunswick area, had a very low vaccination rate for COVID. There were high testing rates and things. So it turned out that we had Dr. Wynn actually came down as a result of that and spoke at a church and had quite a group that was able to talk about, yes, we can get vaccinated. It gave us an opportunity. We used some of the funds we got from the grant to advertise, to let people know you can come get your COVID vaccine here. You don't have to be a patient. Come, we'll do testing, we'll do clinics. So we were able to use our money that way to help spread the word. But we had a men's breakfast that BHA and CVHS put on as a result of this. And I think we had 60 gentlemen come for breakfast on a Saturday morning to hear about different health screenings and to talk about their health. We had a HPV seminar one night for people to come in. They could Zoom in or they could come in person, and we came down and did that. So we're trying to reach out and really do that. And then what you picked up on inviting us to is this column we've been running in the newspaper, taking turns with the article first coming from VCU with kind of the technical terms of this is a health issue you should be addressing, and then the Brunswick Health Ambassadors talking at a local level, and then us coming back in at the clinical level of how we can help you in the community, because it's tough. It's a community for your listeners that to go get a colonoscopy, depending where you live in the community, it could be an hour and 45-minute drive.
Yes.
And then you need to get a chaperone to go with you. So you can't do it by yourself. You need a companion.
Yes.
And now with the price of gas prices, we're, really seeing more and more people not wanting to go, let alone being able to afford it if they have insurance, but going to VCU, which is the only place in the area that offers financial assistance. It's a sell. And of course, after the pandemic, it was always a longer screening process because there's not enough specialty doing it. But now with the pandemic and backup, with not being able to do them for so long, it's a long time. And so you're scheduling someone 4 or 5 months out for a test that they have time to think about not getting or being talked out of, or rethinking whether they want to do it, or if they have to go for the consult first. So it really is important to be able to talk to this community and be able to say it is worth the cost that it's going to and time it's going to take for you to get there. So we use some money. We have gas carts to help people afford the transportation if they have that. And we're looking at all different ways of how we can help really navigate and get patients to get down to what's really keeping you from keeping that appointment or getting that screening, or why this is important. Our next big push is on personal health history, because a lot of people don't know what their health history is in their family, so they don't even know if they should be getting these screenings if they're eligible. So it's been such an important collaboration between the 3 groups of really being able to share the information and bring some clinical conversations to the community.
And this is why, we have this podcast. It's because of all that Paula has outlined, right? for how federally qualified health centers are made up. This is what they do, right? This is their focus. And Dr. Tossas, you talked about it was just the natural, right, partnership for this program coming out of VCU, to be able to partner with federally qualified health centers to be able to address some of these issues. One of the things I also want to say is we just finished doing a show where we actually have an individual a physician who's going to be coming into the Commonwealth and working with many of our providers, because one of the things that we know in this community, the Brunswick community, as well as other communities, is really around health literacy, right? And being able to speak to the community and the patients at their level, where they are and what they understand. And we're really going to be working with this provider who's going to be working with the providers here at the community health centers around health literacy and using effective tools, right? But then also partnering it with health numeracy, which is something that we learned in that show. And that, to sit there and explain something to an individual in this particular community about that you have a 1 in 1,000 chance, right, of surviving, right, this cancer, right? What does that mean to somebody in this community, right? And so we're looking to help grow our providers in that area and being able to have those conversations and be reminded that those are the kinds of sensitive conversations that we had to have. And there are tools, there are practices, evidence-based practices that they can utilize to make that difference. So, one thing I do want to touch on before we close out is one thing we do know, Paula, in working in a federally qualified health center is that we do deal on many occasions with individuals who just feel like for so long they've gone without, right, when it comes to healthcare. How do you convince, especially in a community that is ranked so high, although it's getting better, but still ranked very high in health factors? How do you convince, individuals in this community that, it's not okay to go without? It's not okay to just settle, right? That we are here to help you, and here are the things that we can do to do that. How do we do that, Paula? And then Dr. Tossas, you can finish it out for us.
So I think one of the most important things that we do as an FQHC, and I think a lot of FQHCs do this, as part of our core values, is building the relationship with the patient and building that trust. It's not like a free clinic where you may not see the same provider every time you go because people are volunteering. Our providers are hired, they're part of the team, they're on site, they're on staff, as you said, and a lot of times they're in the community. They build a trusting relationship with the patient, and we can help make that push. And then when we start saying things, there's belief in it, but they have to trust us, especially with the minority populations, because they have been so put off by some of the very traditional systems and for a variety of historical reasons. And so we have to work extra hard to build that trust so we can say, this is why we want to do it. I was very moved by the information that we got that in Brunswick, the reason VCU wanted to come was because there was so little screening and so many patients were coming in late stages. It's more expensive to treat it in late stages. Chance of survival is so much lower in late stages. And it's just like, we can stop this. We can make this better. We can make such a difference in the life of this family, of this person, if we can get them in earlier. And so we have to be committed to doing the work of really getting people to trust us and then delivering, and that carries through. So that's why it's important for us to have partnerships like this with VCU, because if we build that relationship and get them set for the colonoscopy, for example, and then they get up to VCU and it falls apart, we've lost them. Right. So it's important for people like Dr. Tossas and I'm very thankful that she's reaching out, understanding the value. She and Dr. Wynn understanding the value of FQHCs in the community and wanting to work with us and what we can do to make this easier for people to, again, trust the system that we want to do what's right. I think that's really what it is. The partnerships matter. It's not about the money. It's about the outcomes. It's about making a difference and us recognizing that if we have to do more for those that have less, and that's all that's to it.
Yeah.
Dr. Tossas?
Yeah, so a couple of things, because there's a couple of things that you said that trigger some thoughts. Number one, we actually have another project, I have another grant that I co-wrote with a couple of colleagues, where we actually are learning about the bilingualism of science and clinical care and research. And what that grant is all about is, again, around acknowledging what we call community intelligence, and us as researchers actually going into the community and presenting our science and presenting our work and speaking and requesting input from the community around how to better communicate our science and our work, right? To address, health literacy and health numeracy, because oftentimes the thought, from when you have this academics or clinicians, is like, well, I know it all and you don't know anything, and let me just teach you what these things mean, when really there is truly the value lies on me saying, hey, can you tell me how I can better communicate this with you? Because this is the analogy that I use. My first language is Spanish. I speak Spanish very well, and I can explain to you something very well in Spanish. And you will say, I had no idea what you said. And I'm like, I don't understand. I explained it to you very well. Well, yes, you did. But you did it in a language that I did not understand, right? You spoke Spanish to me and I only speak English. And so therefore, if my job is to communicate to you information that's important to you, the most important thing here is for me to figure out what is the best way to communicate that to you in a language that you understand and that is native to you. And so I think there's a level of, like humbleness, right? And acknowledgement and grace that we as scientists and as clinicians really need to have to acknowledge and receive that community intelligence so that we can achieve the goal of providing better care and to improve the care of our community. So, that's what that one grant does. I also I would be remiss if I did not say that though Paula was saying that they had really great rates to begin with a colon and cervical cancer at their clinic, which is very true. And still, through this program, the Brunswick County FQHC has increased their colon and cervical cancer screening rates by almost 11%. And I want to sort of harp on the fact that how incredible that is in the midst of a COVID pandemic, where cancer screenings across the nation decreased by upwards of 50%, 100% in some places, that this FQHC in Brunswick County was actually not only able to not reduce their cancer screenings, but even improve on their prior good screening rates, is really a powerful thing. And so the last thing I will say is to answer the question that you posed, which is around, well, how do we motivate community to really know that they are worthy of this care, that they really should seek this care for themselves? I will use my own father as an example first, that, he's this like 70-something-year-old man living now in Houston. He's alone. His wife passed away. He only has an only child. His only child's going to be okay. So I was like, whatever. I have to die of something. I hear that all the time from him. I do. Right. And so, some of the things that I use as a daughter is to say, well, that is very true. And, you are going to die of something. But right now, I still need you. Right. So I would like for you to be here. Your grandchildren will need you. And they are watching you. You have 2 boys that are watching you and how you take care of yourself as a man. And so, we have this concept in the Latino community that is called familismo, right? And so that you may not care about yourself, but you sure care about your children and your family. And therefore, that's one opportunity that we have as providers to sort of motivate and say, look, if you don't do it for you, can you do it for me? Because I still need you. And I miss you when you're not here. And it'll be hard if you don't take proper care of yourself. That would be really difficult. And I will use a Brunswick health ambassador, one of the men that I recall. I went to the meeting and he said, one of the things that we do is we do this community walks where we partner us as elders with a child from one of the Brunswick County schools. And he was telling the story, this anecdote about walking with this young boy who was morbidly obese. and how the little boy and his family just didn't walk with him, didn't want to do anything with him because the little boy was always tired, was always overeating. But this elder from the Brunswick community, this older Black man, decided to go to his house and once or twice a week go for walks and talks with this young man. And slowly over time, you saw the young man sort of becoming self-motivated to exercise and came to look forward to that. But in the process, the elder was like, yeah, but it was kind of hard for me. So I had to start myself getting fitter so that I could make sure that I was available to this young man who needed to go on walks. So another example of why that community cohesion and that community example is valuable. So, I do believe that those are important motivators in the community.
Well, and I think too, in taking what both you women have shared, is the one of the wonderful things about a federally qualified health center. Although it was difficult in the beginning for folks in the Brunswick County to utilize you all and know about you all, and think about you as being that clinic, that health center that they can go to. The health centers are the face of the community. We are right smack in those communities, and we're in multiple communities, quite frankly. But at the end of the day, we are right smack in those communities, and we really can kind of change the pendulum, if you will, right? Rock the pendulum in a different direction, in a positive direction. We really can have the biggest impact because we are safety net providers, and we literally are right smack in these communities. So with that, Dr. Tossas and Paula Tomko, I really appreciate you all taking the time to come and speak with us about the great work that you're doing in the Brunswick County, and with the Brunswick Health Ambassadors, as well as with VCU and Central Virginia, representing those two organizations. Please keep up the good work. Dr. Tossas, please continue to work with Central Virginia as well as some of the other federally qualified health centers, because really at the end of the day, it's really, it is the FQHCs that really can move the pendulum in the right direction when it comes to providing the kind of safety net care. So with that, thank you. I want to thank my guests for joining us today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.